Well, good evening. I'm Peter Kern, professor of political science here and director of the program in global public health. And I'd like to welcome you to the lecture series co-sponsored by the Global Public Health Program and the Institute for Health and Humanities. Tonight we have, I guess you could say, maybe a surprise lecture for you. Because the original idea was to have Michelle Serres talk about her work in Haiti. But Michelle, unfortunately, is not able to be with us tonight because sadly her mother passed away just 2 days ago. So we were very fortunate to be able to find a last-minute substitute for Michelle, and that worked out because tonight's speaker was planning to do a talk in my class a few hours ago. So she was willing to postpone her talk and be the speaker for tonight's lecture. So I'm happy to introduce Haley Wright. And Haley's going to talk about Missoula Medical Aid, from disaster relief to community building. Certainly a topic that fits really beautifully into the lecture series as we have conceived it and planned it from the very beginning. Haley is a local person. She went to high school and college here in Missoula. Then she got her BSN, her Bachelor of Science in Nursing from MSU in 2006. And she's worked as a critical care nurse since then, except for 18 months in 2014 and beyond, when she taught English in Shanghai, a place that I happen to teach English in as well. So we share that experience together. Her experiences in China and Southeast Asia inspired her to seek a career in global health, and she's currently pursuing her MPH here at the University of Montana. In April of 2017, she traveled to Honduras with Missoula Medical Aid, and she continues to serve as a committee member with MSA. So that's what she's going to be talking to us about today. So please join me in welcoming Haley Wright for the lecture tonight.
So welcome to the surprise presentation tonight. So yes, I had the opportunity to travel to work with Missoula Medical Aid last spring. About 1 year ago, I think today, I was returning from that, working with one of their medical brigades in Honduras, and it was a pretty amazing experience. So who are we? Missoula Medical Aid works with rural and impoverished communities in Honduras as they seek to improve health and access to health care. So Missoula Medical Aid got their start back when I was in high school. I remember hearing about them and their work, and Hurricane Mitch was I believe a grade 5 hurricane that spent about a week over Honduras, and it was incredibly destructive. About 9,000 people lost their lives. Tens of thousands of people were left homeless, and groups in Missoula wanted to help. So some folks from Nightingale Nursing got together and got some medical people from the community together and sent down some relief workers. And they went, and then they went again, and they went again. They went 4 times in a 4-month period. They developed connections with the community. They were hugely moved by what they saw down there. And what they realized is that Hurricane Mitch was an acute on chronic injury to Honduras. So if you've heard of an acute on chronic illness, if you have asthma, that's a chronic illness. You manage in your day-to-day life, you get by. If you have the flu, that's an acute illness. It comes out of the blue, it hits you, and then you move on. But if you have asthma and then you get the flu, you're way more likely to end up in my ICU on a respirator and potentially lose your life. So when a disaster hits a place like Honduras, which already has so many problems that they're dealing with, it really has a much larger effect. And so 66% of Hondurans live in poverty. About half of the rural households live on less than $1.90 a day. There's limited access to clean water, limited access to health care. Although there are government services, they only have about a quarter of the doctors per capita as we have here in the United States. And in rural areas, it's even more difficult conditions. They have high crime rates. If you've heard in the news, kind of a lot of hype about MS-13 in this country, but in Honduras, they have a very real presence. People deal with a lot of violence. They've been off and on the highest murder rate in the world for over the last couple decades related to that. And they also have the highest inequality in Latin America. I think when we think about places like Honduras, a lot of the times we kind of just think about a lot of poor people, but actually what really struck me when I went down there was seeing the kind of tin shacks right next to villas with walls, security guards, and barbed wire fences. So it's not that resources don't exist down there, it's just that they're not distributed very equally. So the question was, what do we do now? So Missoula Medical Aid moved from disaster relief, which is a really kind of a short term, there's a catastrophe, people come in, they save the day, hopefully, and then they move on. So they move from that kind of perspective to one of community development. So that's where it's a process designed to create conditions of economic and social progress for the whole community with its active participation and fullest possible reliance upon the community's initiative. And this is, I think, the last part is really important. You have to involve the community itself if you're going to build it up. If you're just coming and you're distributing water for a short period of time and doing surgeries for people who were injured in the hurricane, that's one thing. But if you actually want to build the community and develop it, you really have to be involved with the people who are members of that community. So this, how do we do that? I should say social ecological model. If you have been in public health for long, you will see this. It's a really common kind of framework for looking at how to approach public health problems. So you consider the ways that there are interactions between all these levels, from the individual all the way up until like the public policy or the overreaching culture. So Missoula Medical Aid does do this in a couple of ways. They work on, going back to their mission statement of improving access to health care. The medical brigades, I think, are what most people in Missoula think of when they think of Missoula Medical Aid, and it is what I was involved in when I worked with them last year, and that's there's two aspects to that. There's a rural health and a surgical team that go down. And these are kind of helping individuals. This is helping people with their immediate problems and overcoming what they have. And then there's the Lions Dental Clinic in La Esperanza, which provides dental care, and they are on the ground 365. So they're actually part of the community. And they operate with some support from Missoula Medical Aid. And then there's these community medical boxes, which are helping, they're like tiny pharmacies and kind of people with a small amount of training on how to distribute kind of basic medications. Let's see. So the medical brigades. Missoula Medical Aid only has 3 employees. Everybody else is a volunteer. There's Jordan Lab. You can see her here in the corner, organizing things. There's so much organization when you go down on one of these medical brigades. You bring everything, you pack them in these crates that you then haul through airports and through customs. And if you want to go on a medical brigade and think that it's not going to be a lot of physical work, then you're misinformed, because it's a lot of huffing and puffing and stacking and organizing, and not maybe as much glory. If you're in it for glory, I'd recommend rethinking it. And then there's Doris Martinez, and she came on with Missoula Medical team as an employee back in the fall of 2017, and she is from Honduras, and she lives there, and she does a lot of the groundwork in Honduras to make things happen. And then partners. are very important for Missoula Medical Aid to be able to function with just 3 of its own employees. Being up here at a great physical distance from Honduras, it was important for them to find an organization that had a network, that had resources, and people on the ground. So they work with Save the Children, which is a really well-known international aid organization, and that has full-time employees. They have actually a compound that we go and stay on when we're in La Esperanza, and full-time employees that really are from the community, know the community, and are able to do the outreach and the groundwork that's necessary. And then there's volunteers, which are just made up of various medical providers throughout the community, nurses, doctors, pharmacists, OR techs, and the like. And usually a couple of kind of friends or family members who come along and just provide some extra sets of hands. So this is the hillside around La Esperanza. You get pretty far out there. La Esperanza itself is a decent sized, like small city, maybe Hamilton size or whatever. It does have some resources and stuff. When we work in the medical brigades, however, we're going out to these rural communities that are over really bumpy roads, and the people living out there aren't regularly able to come into town. There are government clinics in town that do have some resources, although they are limited as well. But for people in these communities, it's very difficult for them to make it. So we bring the clinic to them. And so Save the Children identifies schools and communities that are interested. They kind of have a little holiday. These are some kids playing on there. Can you see these well enough with this lighting, or does it need to be darker? It's okay? All right. So they're enjoying a day off while, and everybody in the community gets pre-notified, and that's why it's so important to have that partner that's on the ground there. Otherwise, you'd be down there with nothing to do. No one would know. So we set up in the schools, and everybody's, the families come and they wait. They're usually there waiting for us in a line, and they wait patiently while we try to organize all the supplies that we've brought in a schoolroom. And you think you get annoyed at the doctor's office if you have to wait like 15 or 20 minutes, but these people, for just a basic health exam, sometimes they're waiting like 3 or 4 hours out in the hot sun. So we provide in the rural brigade provides family medical exams and screenings. I think on my trip we saw about 750 people in the community, and all told, Missoula Medical Aid reaches about 5,000 people a year with some basic medical help. Basic medications, people were really excited to get their hands on some multivitamins and ibuprofen, Pepsid, and things like eye drops were very, very, very popular. It's kind of the dry season when we were there and dusty things, so people were just really excited to get their hands on things that we take for granted here a lot. And about 300 or so more serious cases are identified from these screenings, and Save the Children will follow up. Missoula Medical Aid will provide the funding to get back to those people, get them the transportation they need and the follow-up, like specialty services they need. This child actually had some kind of developmental issues going on. It was probably genetic. Andres here, this doctor is actually a Honduran doctor who is training to be, he will be, when he finishes his residency, the only pediatric endocrinologist in Honduras. And he kind of identified a genetic issue going on with this kid, and Save the Children will work with follow-up care to get him some specialty medical services. Sometimes it was a little heartbreaking. I remember, I think it was the same village because it was the indigenous village that we went to. One gentleman came in and his heart rate was in the 150s and his blood pressure was over 200, and he came in because he was short of breath at the end of the clinic day, and he had a hypertrophic cardiomyopathy, which is really difficult to treat in the United States, but he'd been diagnosed with it some years ago, and we looked at him and we said, come with us, the clinic's almost over, come with us, we'll take you to the hospital. Well, the hospitals in Honduras, they don't provide food, they don't do your laundry, so if you go to the hospital, your whole family will come, camp outside, and actually cook for you and do your laundry. And he said, I'm gonna go talk to my wife. I'm gonna go talk to my wife, and maybe tomorrow. And as we were leaving, I said, he is so sick right now, how is he going to get there tomorrow? In my kind of broken Spanglish with one of the workers, and they said, who knows? So it was pretty clear that he made the choice not to be a financial burden to his family at the end of his life. And it was a really sobering moment of what kind of privilege it is to just be able to walk into a hospital. Not everybody has that everywhere. Women's health clinics. For some of these women, this is the only time they'll ever have a pelvic exam. And they provide, a provider and privacy, and they get to actually ask questions that maybe they've never been able to ask before. So that's a really important part of the program and popular as well. Let's see. One part people love are the eyeglasses. We bring thousands of pairs of eyeglasses with us and distribute them. And you might, at first I was like, okay, that seems kind of weird. I mean, you don't usually think of kind of rural farming communities as having a lot of need for reading glasses specifically. We're not doing like full optic exams. These are just the readers. But it's in that Spanish there is to thread the needle. The older women, as they're not able to perform, and some of the younger women, but especially as they're less able to perform physical labor, contribute to the economic prospects of their households by doing the traditional weaving and sewing. And this is a group that comes and visits the team when they're at the Save the Children compound every year and sells it, because they know that we will buy a lot of their pottery and their weaving and stuff, but it's just something as simple as a pair of reading glasses really turns into a whole economic opportunity for people in these communities. The other aspect of the medical brigade here are the orthopedic surgeries that we do. So this is Andy Puckett. He's a hand surgeon with Missoula Bone and Joint. Christy Sullivan, she's with Missoula Anesthesiology. Jen McElroy, she's a OR nurse with Missoula Bone and Joint. Brandon Lane's a PA. Rob Wright is a surgical tech at St. Pat's, and this Tomas was their go-to guy in the hospital. And like I said, there's a real lack of healthcare providers, so the ability to get a surgery that restores function is really life-changing on the individual basis for the people they are able to reach. They go in and set up a clinic on Monday, they screen people, and they performed, I think on our trip, about 35 surgeries. From a lot of times it was releasing, like if one man had a burn and it was releasing scar tissue so that he could like function, and it really returns people their ability to work and really function. There's that. In the past, there'd been a lot of instances where they kind of ended up pulling a lot of teeth, and it was such a big part of it that they ended up realizing that the way to deal with this was to have somebody find a way to make it happen in the community, and find a way for it not to just happen once a year or twice a year when Missoula Medical Aid comes down, but for it to be happening all the time. So they work with the La Esperanza Lions Club Dental Clinic, and for people in the town of La Esperanza, they're able to get dental care year-round. And there's that. So going back to the mission, Missoula Medical Aid works with rural and impoverished communities in Honduras as they seek to improve health and access to health care. So we've kind of looked at the access to health care component, and the rest of it is about improving health. So they have developed over the years a variety of interventions and projects to try and help improve the health of people in the community. This comes from the Healthy Homes, which is about chimneys. There's dental hygiene starting in the schools, economic development and farms, scholarships, nursing. They've also added, this is actually outdated information, they do 4 nursing students a year, and I think and a couple of dental hygienists, and then also early nutrition, child nutrition and early stimulation. So the Healthy Homes got started as a project when a physician on one of the rural medical brigades realized how many people he had coming in with complaining of a cough and complaining of black sputum. And he, just kind of looking around, noticed that people were actually doing their cooking inside in unventilated areas. And that was leading to a huge amount of respiratory illnesses. And we tend to think of air pollution, I think, as being a big city problem and a big, it comes from factories, and but there's actually a lot of sources just around us, and a lot of people in rural places suffer from environmental air pollutants as well. And so they started a program, again, working with Save the Children. The Missoula Medical Aid helps fund purchase of the stoves. Save the Children goes out and helps teach people how to make the stoves in a very, it's not, as you can see, it's pretty basic. It's not rocket science, but it's really life-saving and health improving for people. And they just kind of make it a part of the community and help make it part of just home improvement for people, which has turned out to be a really great program. There's dental hygiene. When we do go out there, and we're seeing a lot of the same communities year to year, but we distribute some fluoride. The Lions Club works to distribute toothbrushes to the school, and so these are government schools, so it's part of, they cooperate with the program, which is really great, and teaching kids dental hygiene, at an early age before it becomes a problem. Chronic malnutrition is a problem in some communities. As much as 40% of the children suffer from chronic malnutrition, and we know that having malnutrition in childhood leads to a plethora of problems later on in life. Missoula Medical Aid had worked to address that. It's not that there's not food in Honduras. There is plenty of food. It's that people in these rural areas have a difficult time getting it. They don't necessarily have the transportation, there's not the infrastructure of roads, and there's a lot of hazards. Hungry dogs, and also, sometimes criminals. There's a lot of drug trade coming through and stuff, so it can be an issue when people are traveling. They don't want to be out on the roads. So Missoula Medical Aid with Save the Children had worked on establishing communal places for the children to get healthy meals every day in a few communities. They have the food actually comes from either the communities, some of it's donated, some of it comes from government programs, but they find they found established places in the communities to bring the food, and then the mothers come in, they bring up the fuel. The mothers all get together and cook a healthy, nutritious food for their children that maybe they just couldn't access on their own, but they're able to do it together. There you go. This is one of the stoves. It's got proper ventilation. And people enjoying a good meal. Another part is early childhood stimulation. In places where people are working, kind of subsistence level living, kids are kind of left on their own. And if the older children might be in school, but the younger children don't have a lot of, exposure to the educational materials. And so when they do these meals, the young kids are there and they kind of do like some preschool activities, just cute kids playing with finger paints. But it can be really important, and it really sets them up to succeed when they do get into school later in life, having kind of this early intervention in the community. Another part of the Missoula Medical Aid mission is working on healthy farm projects. So this is, again, is with Save the Children, that we provide funding, things like seeds and to buy seeds, to buy animals or whatnot. And Save the Children goes out to areas and helps people work on sustainable techniques. And yeah, so there's various animal farms. This works in the form of microgrants as well. People come and say, hey, I want to start a chicken farm, but I need, I need this many supplies, or I want to raise some pigs. And the investing in a cow for a community can be really big. They get, there's so much that comes from that, and it makes that the early childhood meals much more, I think, valuable when it's the community doing it for themselves. It really gives them a chance to foster independence, and then hopefully one day Missoula Medical Aid will put itself out of a job. This is another one of the community farms up there. And yeah, the shade-grown coffee and reusing the pulp. These guys are really cool. They were known to some of the people with Missoula Medical Aid for when they were actually like young kids, and they came together with a proposal to start a tomato farm. And that has, over the past few years, grown into a successful business. And they have, actually, I think it's Walmart that buys their tomatoes, but having a regular person to sell them to is a huge leg up. And Missoula Medical Aid was able to be part of that, which is pretty exciting. And now they're completely self-sufficient, I think. The other one is local women in one community came together, and they had been growing corn and milling their own corn and then baking for their families, which is very labor intensive and pretty inefficient. So they banded together and got a grant to start a communal mill, corn mill, and now they're able to produce enough corn flour not only to feed their own families in a much more efficient way, but they also are able to sell the baked goods. So the women are brought into the economy, and that really brings them a lot of power in a society that's not always the most gender equal. Being able to be a productive part of the economy really lends you a lot of power. And I think one of the really important aspects are the nursing scholarships and the dental hygienist scholarships that Missoula Medical Aid provides. Again, this is Save the Children helps identify people in impoverished communities who are interested in pursuing a career in health. They kind of follow them, throughout their career, and they don't require them to come back and serve the community, but many of them want to go back and help improve their community and provide a service that is really important to them. So I think that's one of the really most important things that Missoula Medical Aid is a part of, is kind of providing this infrastructure for the future and investing in the people that are part of the community. So here's the team that I went with. And we worked with it was really great people. There's a couple of these are our Honduran doctors that are down there. And Danielle he's in dentistry school and he works as a translator. There's Doris again, she's great. So it was a really powerful experience to just be down there and be part of it. Working with all the people in Honduras and the partners that we've established down there, and just helping create healthier children and healthier communities. So that's what I have.
If you have questions for Haley, who would like to start?
So how does Missoula Medical Aid devise sort of the umbrella of all these different interventions? Like what was the thinking of targeting like education and dentistry and so on and so forth?
Sure. I think that from what I know, of what I've gathered with working with them is it kind of grew organically over the years, and of going down there and just developing relationships with people, and through listening to the needs that they heard from people in the community as they were working there, they kind of they didn't come in like with a full-blown plan, but they identified needs as they met them, and you know, developed programs to try and address those needs kind of as they went along. Yes.
Where do they get the funding?
It's donation-based. So a lot of it comes from the Missoula community. They have like the salsa ball every year, which is a lot of fun. And they have a silent auction that's a lot of donations from the community and stuff. All the volunteers who go down self-fund and fundraise to contribute to them. And then they do, I think, apply to grants from different larger organizations that fund them, but yeah, it's all volunteer and donation-based funding. Yes.
Does Missoula Medical Aid do program evaluations for?
You know, I don't think they do at this point. They're kind of they're such a small kind of organic organization that they've kind of grown over the years, and I don't think that they've really kind of approached it from that angle, but I know they are evolving and changing as they grow, and so I wouldn't be surprised if they, you know, try to incorporate more of those kind of techniques and tools in the future. Yes.
So going back to like disaster relief, Honduras is in a place where hurricanes are not unlikely, right?
Right.
So does Missoula Medical Relief do anything to help prepare them for future hurricanes or future disasters, like, I don't know, helping them store food or have a plan?
Sure. You know, I don't think directly. I think it comes back to that concept of the acute on chronic, and the idea that if your conditions are better on a day-to-day basis, that when something somewhat unpredictable or you know, like the flu season is predictable, but it's still acute, but that you're able to deal with it and cope with it better, that if you have more people in your community that are trained to provide health care, that you're more able to cope when something like that does arise. They don't do any work, to my knowledge, directly with disaster preparedness at this. It's not, yeah, that's not part of their mission, so they're focused on the health and improving the community. Yes.
What is like the average duration that like, a volunteer would spend in Honduras or?
Oh, it's a 1-week mission or a 2-week mission, depending. So they do, like I did. I was like nine days in Honduras. So it's a quick trip. It's a lot more kind of planning goes into it, and but it's over really fast.
What would you say you brought back from your experience in Honduras that you can use here?
I mean, it's a really eye-opening experience, I think. It makes you think outside of your own health system, and think about how things work in the broader world a little bit. As far as, I think one thing that I noticed down there is that like the indigenous communities had it much harder than the like non-indigenous villages, which I think applies almost everywhere in the world and applies to our own indigenous peoples in Montana, and how like extra support is needed in areas like that versus the general public.
Is there anything that you do differently in the ICU unit now after having been down there?
No. I think it improved my ability to kind of think about where some of my patients are coming from. That some of them are coming from conditions not unlike what you see down in Honduras, that some of them don't have access to it's not easy for them to get to the doctor to follow up on their, you know, diabetes, like checkups or whatever they need, and that the reason they end up in my ICU is because they didn't have that foundational kind of groundwork to help them succeed outside of the acute care system. So I think I just have a little more compassion maybe and empathy for what got them to where they are, and in dealing with them to take into account that it's not easy for everybody to access medical care here either.
It's very important. Any other questions?
What about preventive immunization, that kind of stuff? Has Zika hit Honduras?
I think there have been some cases of Zika. It's not something that that Missoula Medical Aid has addressed. But the immunization, there are immunization programs there that are government run, so we don't provide duplicate services with that. But
The shots you got before you went down.
oh,
The shots they're getting.
right. So it was things you might want to consider before going to Honduras, as far as.
And comparing, like, the list of things you were recommended to get and you probably got, and the list of things that they might get from the government.
I don't really know that much about. I'm not sure what is on their government immunization list. Because I'm a healthcare worker, I didn't get any extra immunizations to go down to Honduras. I'm pretty fully immunized as it is with like the hepatitis A and B and all that stuff. So I get jabbed pretty regularly for those things. But that's an interesting question. But I'm not aware of what the difference in their immunization schedule might be compared to ours.
Okay.
I was kind of just wondering, because I'm really involved with dentistry, so I was just wondering how what their dental field looks like, I guess. Like, are they just pulling teeth all the time? Is that what they're looking forward, or are they actually advancing modern dentistry into their field at all?
Sure. They do. They have the full range of socioeconomic statuses down there. So people who are rich and can afford to go to a well-funded facility can get pretty good dental care. But at most places it's a question of, like in dental school, you have to bring your own gloves. So like the gentleman who was doing our translating, he was like, "Are you gonna take these gloves home with you, or can I take the exam gloves, because they're really expensive down here?" So it's although they have the education and the techniques, the supply chain isn't always there. They don't have a lot of manufacturing, so everything has to be imported. And to be imported, it has to get there by truck through these mountain roads. And so it's not that they're unable to do modern or unaware of modern dental techniques. It's that actually getting the supplies can be a big barrier for them.
Yeah, so I'm particularly impressed by the work that Missoula Medical Aid is doing, and for a number of reasons. And fortunately, we've had Dr. Puckett and others, Dick Barrett, come and talk about Missoula Medical Aid. I think it's something we should really have on this lecture series agenda every year. But the things that really impressed me that Haley mentioned today are, one, the fact that they had a really good, reliable group of local partners, people who have been working in Honduras for a long time and who can provide that kind of follow-up care that is so critical to these kinds of efforts. So you don't go down there for just a week, as she mentioned, and then leave, but there's follow-up as well. And secondly, there's quite a bit of emphasis on training and capacity building and capability building. I think that's really important too. And so, as she mentioned, down the road, the idea is that Missoula Medical Aid won't be needed any longer in Honduras, because you're going to be able to create local capacity to carry on, and you can then engage in an exit strategy, which I think is always important to keep in mind, even when you start out in a different place, that you don't want to be there forever. You want to start planning your exit strategy right from the beginning, and I think Missoula Medical Aid does that. In answer to Jared's question, I was thinking, if you really wanted to be ambitious, you might think next about Puerto Rico, because Puerto Rico had a very similar kind of hurricane, but I think it was, if not even more devastating to Puerto Rico, because of the fact that power has been out for so much of that country for so many months now. So there's another whole need down there that maybe if Missoula Medical Aid can flourish and expand, they might want to try to get involved with. I'd like to take this opportunity to announce that the Global Public Health Program has been working on trying to arrange a number of internships for students who are minoring in global public health. And we have reached an agreement with Missoula Medical Aid. So we will be having a internship or volunteer kind of program with Missoula Medical Aid down the road a bit. I think they particularly are interested in people who speak Spanish, but I'm not sure, is that an absolute prerequisite, or are they some more
I can talk a little bit about what I spoke with Jordan about. As far as internship opportunities, she felt like a primary one would be if we had a student who was a native speaker or very fluent to actually work as a translator in the field. The other possibility on that is their fundraising event is huge, and having somebody who could help that out. As far as volunteer opportunities, they were able to offer a little more, like putting together the boxes, that kind of stuff. She felt there were some opportunities with that kind of work.
So great. So we're going to be in the next week or so, we're going to be announcing these opportunities beyond Missoula Medical Aid as well, and other. Keep your eyes open for that. And if you have the chance, I think Haley's given you a pretty compelling vision of why this is a good organization to be affiliated with. So with that, let's thank her once again. Let me just mention about next week. So next week, we have a talk by Joe Knapp. Joe Knapp is a cardiologist, and he was, in fact, past director of the medical research unit at the International Heart Institute of Montana, here in St. Pat's. And Joe is going to talk about specialty care in developing nations, an oxymoron or an aspiration. Joe is, I know he's had experience operating on children's hearts in Ethiopia before. And so he's probably going to talk to some extent about that experience, but I'll be interested to hear what else he has to say. So that's next week. See you all then.